Have you ever noticed your baby hiccuping out of the blue? It's a common thing that can leave parents feeling puzzled. Don't worry, you're not alone. Babies getting hiccups is a common occurrence that often triggers questions and worries among parents. But fear not. In this video, we'll explore why they happen, whether they're normal, and most importantly, what you can do to prevent and alleviate them. So let's unravel the mystery behind these baby hiccups. Understanding hiccups. Let's take a closer look at why babies get hiccups. Hiccups are like surprise jumps that happen in our bellies. They happen when a big muscle called the diaphragm, which helps us breathe, suddenly tightens up. This muscle sits right between our chest and tummy. When it tightens, it makes our voice box quickly close, which is why we hear that funny hic sound. You know that feeling when you're startled or scared and your body jumps? Hiccups are a bit like that, but they happen inside us and we don't control them. So, when a baby gets hiccups, it's like their belly is doing a little dance, but they can't stop it. It might seem strange, but it's actually quite normal. Babies' bodies are still learning how to work everything properly, so sometimes they hiccup more than grown-ups. It's just a part of growing up. Why do babies get hiccups? Firstly, their nervous systems are still growing, which makes them more likely to hiccup. Secondly, when babies eat, they sometimes swallow air, especially during breastfeeding or bottle feeding. This extra air in their tummies can lead to hiccups. Moreover, if babies eat too quickly or consume too much milk, it can upset their tiny tummies and trigger hiccups. Changes in temperature can also play a role. For instance, if a baby moves from a warm room to a cold one, their body might get a little surprised and hiccups can happen. Additionally, just like adults, babies can get hiccups when they feel nervous or excited. It's their body's way of adjusting to different situations. While hiccups in babies are generally harmless and nothing to worry about, there are ways to help prevent them or soothe your baby if they're bothered. It's essential to feed your baby slowly and burp them frequently during and after feeding to release any trapped air. Keeping the room at a comfortable temperature and creating a calm, relaxed environment can also help. If you ever notice that your baby gets hiccups a lot or seems uncomfortable because of them, don't hesitate to reach out to your doctor for advice. Is it normal for babies to get hiccups? You might be wondering if it's normal for babies to have hiccups. Well, the good news is that it's entirely normal, especially during their first year of life. Babies tend to hiccup more often than adults because their little bodies are still learning how to work properly. Hiccups happen when the diaphragm, a muscle beneath the lungs, suddenly contracts, causing a quick involuntary breath that makes the vocal cords close. This closure produces the hic sound we're all familiar with. Most of the time, hiccups in babies are harmless and go away on their own without needing any special treatment. It's like a little quirk of being a baby. However, if your baby gets hiccups very frequently, or if they last for a long time, it might be a good idea to talk to your pediatrician. They're doctors who specialize in taking care of babies and children. Your pediatrician can help you figure out if there's anything to worry about or if there are any ways to help your baby feel more comfortable. They might suggest some tips, like feeding your baby more slowly or keeping the room at a comfortable temperature. Sometimes, just a little change in routine can help ease those hiccup moments. How to prevent baby hiccups. All right, let's discuss how to stop those pesky hiccups in babies. Firstly, feed your baby slowly. Whether you're giving them milk from a bottle or breastfeeding, take your time. This helps prevent them from swallowing too much air, which can lead to hiccups. Secondly, burp your baby often. After they eat, hold them against your chest and gently pat their back. This helps release any trapped air in their tummy, which could otherwise cause hiccups. It's also important to keep things calm and quiet around your baby. Loud noises or too much excitement can make them hiccup more, so try to create a peaceful environment. Another tip is to watch how much your baby eats. Pay attention to their cues and stop feeding when they're full. Overfeeding can overwhelm their little tummies and bring on hiccups. Lastly, make sure the temperature around your baby stays consistent. Sudden changes in temperature can trigger hiccups, so keep them comfortable and avoid moving them from hot to cold places too quickly. By following these simple steps, you can help prevent those hiccup episodes and keep your baby happy and comfortable. Baby hiccups are a normal and common occurrence that most infants experience at some point during their early development. While they may seem concerning, especially for new parents, rest assured that they're usually harmless and resolve on their own. By understanding the causes of baby hiccups and implementing some preventive measures, you can help minimize their occurrence and alleviate any discomfort they may cause your little one. Remember to feed your baby slowly, burp them frequently, and maintain a calm environment to reduce the likelihood of hiccups. Additionally, avoid overfeeding and sudden temperature changes to keep your baby comfortable and happy. If your baby experiences frequent or persistent hiccups, or if you have any concerns about their health or well-being, don't hesitate to reach out to your pediatrician for guidance and reassurance. So the next time you hear those adorable little hiccups emanating from your baby, take a deep breath and know that it's just another part of their miraculous journey through infancy. And who knows? Maybe one day they'll look back and laugh at those funny little spasms that once puzzled us all. Thank you for watching, and until next time, happy parenting.